Dave Webster, Associate Director of Pharmacy Services for the University of Rochester Medical Center. Our medical center, the University of Rochester Medical Center, has many different components. 3 main hospitals, the largest hospital being Strong Memorial Hospital, about an 850-bed Level 1 trauma center, sees well over 100,000 ED visits a year. Our pharmacy dispenses close to 18,000 doses a day, so a pretty busy medical center. One of our strategies around improving patient safety at the University of Rochester is really looking at areas of risk. And one of the biggest areas of risk that we see is in compounding sterile products, both from a potential contamination standpoint or from a medication error standpoint. So what we really wanted to accomplish by evaluating technology and looking for different processes is to bring our outsourcing needs into the hospital and into the hospital network so that we could really take on all of the responsibility and accountability for the safety and quality assurance in making these sterile products. At the current time, not all of our sterile products are compounded in-house. We have several items, though, that we do make either patient-specific that are sterile products or items that we make in standard doses that are made in a batch form. Right now we do use some robotics to do some of that, and our plans are really to increase that. All of the hospitals that are within the network will be serviced by the central compounding center. It'll happen over time. You know, it's one of those situations where we're going to bring up certain centers first and have a migration. The offsite compounding center is located about 5 miles from the main medical center and is really put in a situation where it can easily service as far as distance and reliability of transport all of the hospitals in the network. But we've built a clean room facility in this offsite building, a USP 797 compliant building that could also be CGMP compliant if we need it to be. Yeah, we have a pretty extensive training program. A lot of it is focused on sterile technique, USP 797 training. All of our technicians are trained at a very high level for several weeks around sterile technique and compounding, as well as our pharmacists. And then there's also a great deal of training that goes into the technology that we're adopting. So how to use robotics efficiently, how to maintain the system, how to make sure everything is clean and aseptic in all the processes, as well as training on some of the manual stations we'll be using to also ensure accuracy.
Please visit us at drugtopics.com, join us on Facebook, and follow us on Twitter.